Hello students, let's start our today drug that is Chelidonium majus. It belongs to the family Papaver family. And the common name of this drug is celandine. So common name celandine, family Papaver family. About constitution, light complexion, thin spare, irritable, subject to hepatic, gastric and abdominal complaints. Hepatic, gastric, abdominal complaints, liver, GI disorder, also seen in podophyllum. Every age group, both the sexes and all kind of temperament. So all about constitution, about physical generals, physical characteristics. It is the right-sided remedy, affects the right eye, right lung, right hypochondrium. Liver is situated in right hypochondrium. Abdomen, right hip, leg, right foot, cold as ice and left natural. This is peculiar, also seen in Lycopodium. Right foot is cold as ice, icy cold right foot, but left foot is natural. Means temperature of left foot is normal, but right foot icy cold. About causation, brought on renewed by change of weather or lessen after dinner. Complaints ameliorates after dinner, after eating, less after eating, that is amelioration after eating, after dinner, and aggravation or causation from change of weather. Another physical characteristics about desire. Desire for very hot drinks unless almost boiling hot drinks, very hot. Stomach will not retain them. Also in arsenic. Eyes affects the right side of right eye, periodic orbital neuralgia. With excessive lacrimation, tears fairly gush out, Rustox. Tears gushing out from the right eye, excessive lacrimation, periodic orbital neuralgia means pain in the orbit of the eye which is periodic, intermittent, not continuous. About face, forehead, nose, cheeks remarkably yellow. This is constitution. Face appearance yellow. Face, forehead, nose, cheeks, all appearance yellow. Another one physical characteristics about tongue. Tongue coated thickly yellow. Mainly affects the hepatic, gastric and abdominal complaints. So all the appearance is slightly yellow, thickly yellow. So tongue coated thickly yellow with red edges. Edges are red, but in the center it is coated with thick yellow, showing imprint of the podophyllum. Podophyllum tongue written in Chelidonium. Podophyllum tongue large, flabby with imprint of teeth. Also in Merksol, but tongue of Chelidonium thickly yellow with red edges showing imprint of teeth. About GI symptoms during constipation. GI include constipation, diarrhea, hepatic disease and gallstone. So during constipation, character of stool is hard, round balls like sheep dung. Also in opium, plumbum and chelidonium. Sheep dung like stool, hard stool, stool like round balls during constipation. Alternate constipation and diarrhea. In diarrhea, alternating symptoms of constipation and diarrhea. During diarrhea, character of stool is light grey, slimy, bright yellowish. Light grey or bright yellowish or brown or white, watery stool, pasty, involuntary stool. And Diarrhea mostly at night. Involuntary diarrhea mostly at night. Character of a stool: bright yellowish, brown or white, or light grey, and watery stool. Color of a stool and character of a stool. Character: watery, slimy, pasty. Involuntary: color light grey, bright yellowish, brown or white during diarrhea. In hepatic disease means liver disease. What are the liver diseases? Jaundice. Jaundice referred pain in right shoulder, that is in the lower angle of the right scapula. Referred pain of gallstone, not jaundice. Jaundice associated with pain in right shoulder. Gallstone with pain under the right shoulder blade means right lower angle of scapula. Terrible attacks of gallstone with colic. Cardus marianus. In Cardus marianus also there is gallstone but associated with colic. Gallstone with pain under. So all about GI: constipation, diarrhea, hepatic disease, that is jaundice, gallstone, and referred pain of gallstone under the right inner angle of right inferior angle of the right scapula, that is shoulder blade. Respiratory system: pneumonia of right lung. This is also about lung. First about lung, jaundice. Second about pneumonia. Pneumonia affects the right lung mostly. Liver complications. Sorry. Jaundice in liver, lung, pneumonia. Pneumonia of right lung, liver complications. With liver complications. Spasmodic cough: small lumps of mucus fly from mouth when coughing. Also in Calicar. Some mucus fly from mouth when patient is coughing. Cough is spasmodic cough. About respiratory system: affect the right lung, associated with liver complications, pneumonia of right lung, and about cough, spasmodic cough, and some mucus fly from the mouth when patient is coughing, also in Calicar. About back, this is the pain symptoms: constant pain under the lower and inner angle of right scapula. And skin, this is also about appearance of skin: yellow gray color of skin, wilted skin. Constitution, we can write in constitution: wilted skin, yellow gray color of skin of the palms of hands. Old putrid ulcers. About ulcers with a history of liver diseases, of a tubercular diathesis. Patients suffering from ulcers with a history of liver disease like jaundice or gallstone, we can prescribe this remedy. Old putrid ulcers with a history of liver disease, very important symptoms, asked in Viva. Next, relationship: Chelidonium antidotes the abuse of bryonia. This is the most of the UPSC question or PG question asked in PG, where this line is written: Chelidonium antidotes the abuse of bryonia, especially in hepatic complaints. In bryonia, there is a spasmodic cough with headache, and about hepatic complaints: heaviness in the hepatic region, amelioration lying on the right side, and aggravation lying on the left side, that is lying on the painful side. Modality we can compare: Chelidonium antidotes the abuse of bryonia, especially in hepatic complaints. If frequently we give the bryonia in hepatic complaints, Chelidonium antidotes that medicine. That is the clinical point of view. Compare aconite, bryonia, lycopodium, all the drugs. Arsenic, lycopodium and sulfur follow well and will often be required to complete the cure. To cure, these three medicines often required after chelidonium: arsenic, lycopodium and sulfur. So this slide is from S.K. Dubey. Here may asked in university exam to write like this: diarrhea, about diarrhea, causation, change of weather, time at night, and pulsatilla and cinchona, diarrhea during day. Character of stool: involuntary, brightest yellow, brown or white, slimy. Concomitants: there is alternate diarrhea and constipation. May asked in to write in liver affections: chelidonium is indicated in hepatic diseases such as jaundice, where there is constant pain under the lower and inner angle of right scapula. About skin: yellow grey color of the whole skin, wilted skin of palm and hands. About face, forehead, nose, remarkably yellow, sluggish liver with great fermentation and accumulation of gas in the abdomen. There is nausea and vomiting with bitter taste in mouth. Tongue: about tongue, large, flabby, yellow, showing imprint of teeth. The patient want very hot food and drink. So in liver we have to write about number 1. So we have to write like this: in liver affections, jaundice, pain, skin color, face color, tongue, desire, modality. Modality is aggravation from motion and touch and amelioration from pressure. In hepatic affections, it differ from bryonia and lycopodium. May asked in viva to differentiate between the hepatic affections of chelidonium, bryonia and lycopodium. Both bryonia and chelidonium have stitching pain under the right shoulder blade. Both have stitching pain, bryonia and chelidonium, but both have bitter taste in mouth and yellow tongue. But bryonia differs in its stool, that is hard, dry, brown, while the stool of chelidonium is clay colored, yellow. Both differ in stool. Chelidonium stool is yellow, slimy, but bryonia stool is very hard, dryness of all the mucous membranes. In addition, aggravation from slightest motion is very prominent symptoms of bryonia, whereas it is not well marked in chelidonium. Aggravation from warm drink, food found in bryonia, but opposite condition is present in chelidonium. Chelidonium desires for very hot drinks, unless almost boiling. About lycopodium, lycopodium differs from chelidonium in chronic disease. Lyco is indicated, whereas chelidonium is called for acute condition. First point, chelidonium for acute condition, lyco for chronic disease. Aggravation timing. Lycopodium aggravation 4 to 8 pm is very characteristics of lyco, but not so in chelidonium, especially in rumbling of flatus. In lycopodium, taste is sour. About taste in mouth, lycopodium taste is sour, bitter in chelidonium, bitter in bryonia. The pain of lycopodium are dull aching, while the pains of chelidonium are sharp. Lyco का pain dull, aching, but chelidonium pain sharp, stitching pain. About gallstone colic with pain under the right scapula and sharp stitching pain, yellowish grey color of stool. Skin. About tongue symptoms, skin symptoms, gallstone pain and desire for very hot drinks. And aggravation, this is modality, very important. Aggravation from touch and motion, better by pressure. Both these all things we can write in both gallstone and both the in liver affections. About cough, pneumonia, chelidonium is good medicine when pneumonia associated with liver affections. And location, lower lobe of right lung. is generally affected. Very, very important. Lower lobe of right lung is affected in chelidonium. Dyspnea, pain in the right side of chest and shoulder. Character of cough, a spasmodic cough. Some mucus fly from the mouth when patient is coughing. And desire for very hot drinks. General modalities, aggravation right-sided, chiefly right-sided medicine, motion, touch, change of weather. Amelioration after dinner from pressure. Sulfur often completes its work. Complementary of chelidonium is lycopodium and bryonia. These three may asked in viva to differentiate in liver affections: lycopodium, bryonia, chelidonium. So all about this stuff. Thank you.